Hello everyone, welcome to our channel. My name is Shrujna and today we are with Dr. Harshad Jawalkar. He is one of the leading orthopedic surgeon in Hyderabad who is also exclusively specialized in the shoulder surgery from prestigious King's College Hospital in London. Let's also meet the managing director of the shoulder center. Let's welcome him. Hello sir, how are you doing today?
Hello Srujana and Namaste viewers. I'm doing very well. Thank you so much for having me on this channel. It's my pleasure to be here.
We are so glad that you are here with us.
Pleasure is all mine.
Okay. So doctor, just a quick minimal doubt. Since you have mentioned there are many soft tissues in and around the bone. So how do you discover that which soft tissue got affected?
Oh wow, that's spot on. That's an important topic which I want to cover. I want our viewers to understand this. I get a lot of queries from patients saying this is my X-ray, this is my MRI report. They sent it to my clinic or to myself, and then they ask me what is the treatment. So that is not the best way to go about treating these injuries. So these are all very critical injuries, and the way I decide which injury is present, how to treat them, it depends on a lot of things. So the most important thing is the patient himself or herself. So how the patient describes the symptoms to me, the history taking, that means how the patient describes the symptoms, how the injury happened, how bad is the pain getting better or not, is it disturbing his life, is he able to do all the activities that he wants to do, or say for example if a boxer is not able to throw punches, it is devastating, it's a life-changing event. But the same injury, if it's a housewife, she wouldn't be bothered about punching people. So it's different. So it depends on the person, which is about 40% of the weightage which I give in decisions regarding the treatment and diagnosis also. The second most important thing is my clinical examination. So I have to actually check the patient physically by asking him to do certain movements, by putting my hands on the shoulder and feeling where the tender points are. There are certain provocative tests. For example, I'll be trying to move the ball and socket joint, whether it is moving abnormally, whether the muscles are working or not. I'll have to check the power and all those things.
But that's really a ouch movement. Like.
Oh yeah, of course. I mean, yeah, it is. Unfortunately, it is. It is important. So it has to be done. So I always tell my patients, sorry about this, there might be a little bit of pain, but it is important. It's probably the most important thing that is involved in the
decision. To examine, yes.
The information that I get from an examination is probably the most important part of diagnosing soft tissue injuries and also in treating them. So that is almost about 40% weightage of how in my decision making algorithm. The rest of the 20% is in investigations, like it could be something as simple as an X-ray, which are just shadows of bones, or it could be a CT scan, which will show me the bones. It's very good for bones. CT scan is just for bones. It shows me the bones in a lot more detail than an X-ray. And the last one is an MRI scan, in which I can see the soft tissues, all these structures that we talked about, they are seen in a lot of detail on the MRI. Occasionally I also use an ultrasound scan to identify rotator cuff tears and other soft tissues. But it is not as sensitive as the MRI. It depends a lot on the person doing the ultrasound rather than the report.
So thank you so much, doctor, for giving us informative details on the most significant body part, that is shoulder.
Thank you so much, Rujana and Suman TV. It was an absolute pleasure talking to you, and all the best to our viewers.
Viewers, please like, share and comment. You can always drop a question that you wanted to ask to a doctor in the comment section below, and please call to the number which are scrolling in our video. Plus, you are always happy to visit the shoulder center, which is located in row number 12, Banjara Hills. Thank you so much for watching this video.